Welcome, friends. I am Dr. Chauhan, homeopathic physician. I am sharing with you a small homeopathic remedy known as Baptisia tinctoria. This small overview is useful to my friends who are undergoing their internship training in OPD and IPD because they will see many cases of this remedy. This drug is also known as wild indigo. Historical aspect of this remedy is Baptisia tinctoria was a highly valued herb to Native American Indians, and it was particularly useful in treating pneumonia, tuberculosis and influenza. Remedy profile: it is a short acting remedy best suited to serious infections or septic conditions which have a very rapid course. Habitat: Baptisia is a North American native plant that grows in dry hilly woods from North Carolina to southern Canada. Kingdom: this drug belongs to plant kingdom. Natural order is Leguminaceae. Preparation: the mother tincture is prepared using the root and bark of the plant. This remedy was introduced to homeopathic materia medica by Thomson in 1857. Let us go to the constitutional component of this remedy. The somatic component is not specific, but it is best suitable to children and old people. Psychic component: temperamentally, the lymphatic temperament, and lymphatic temperament means the people who lack energy and they are inactive people. Mind, will, emotion and intellectual component of this remedy has aversion to mental exertion, indisposed or want of power to think. The affinity: the physiological action takes place on mind, central nervous system, peripheral nervous system, mucous membrane and gastrointestinal tract. The thermal affinity is this drug is ambithermal. Lateral affinity is it affects the right-sided complaints. Disease predisposition or diathesis of this particular medicine is for acute infectious and toxic states. Precipitating and predisposing causes include the children and old age people. Why? Because they have low resistant state. Miasmatic affinity. So let us use some markers, and here we are using markers of acute complaints and acute complaints to point the problem with acute miasm. And we know that acute miasm is a flare of psora. Therefore, we interpret this remedy is predominantly a psoric miasmatic remedy. The characteristic features of this remedy include the toxic state, and we'll see the features of toxic state. The face is flushed, dusky, dark red. Tongue at first coated white with red papillae. There is great prostration, which includes mental and physical components. Disposition to decomposition of fluids. So all exhalation and discharges are fetid. Ulceration of mucous membrane. Stupor. Patient can easily be aroused when spoken to, but falls asleep in the middle of his answer. The subject can swallow liquids, but swallowing solid is difficult. It gags. Head or body feels as if scattered about in the bed, and parts rested upon feel bruised. Aggravation. Humid heat in room, pressure and walking aggravates. Emulsion is not specific in this drug. Doses. Tincture to 12th potency is suggested by Boric. Repetition bears well repetition, and duration of action has rather short duration of action. Relationship. Remedy is preceded well by arsenic. Remedy follows well by hamamelis, nitric acid, terebinth. Remedy is antidoted by phytolacca and sanguinaria. Clinical. We have a description of toxemia, which is described by Allen like stupor, falls asleep, being spoken to or in the midst of his answer, tongue at first coated white with red papillae, dry and yellow-brown in center. Later on it becomes dry, cracked and ulcerated. Face is flushed, dusky, dark red with stupid, besotted, drunken expression. This condition we can correlate clinically with typhoid state or septic state or toxic state, which may be because of anything where there is serious infection, whether it is a pneumonia or urinary tract infection. Let us go for typhoid. This medicine is best suited to typhoid in all the stages. The stage of invasion is the first stage of typhoid or first week of typhoid. Here we have the temperature has rise in a step ladder fashion, face is flushed, relative bradycardia is very diagnostic of typhoid, but we have to remember that it also takes place in all viral diseases. The pulse is diacrotic, which is a febrile pulse, tongue coated with red margins and red tip, headache, constipation, loss of appetite, lassitude, malaise. These are the general features of any fever. Abdomen is swollen and gurgling over cecum, because here the Peyer's patches are present where the typhoid bacilli, they settle down and they multiply there. And there may be pain and discomfort. Spleen becomes just palpable by the end of first week of typhoid. We'll go to the second week of typhoid, and it is known as stage of fastigium or second week. It is characterized by high continuous type of temperature. The mind becomes dull, patient is in stupor, and there is a pea soup diarrhea, tongue dry coated, pulse having fast rate means tachycardia, there is a cough, abdomen becomes much more distended and tender on palpation, spleen and liver becomes just palpable in the early second week. Rashes may be present, delirium, muttering delirium, coma begins shows the serious state of toxic presentation, and by the end of second week you will find a spleen will be much more easily palpable. Third week of typhoid is the stage of defeverance, but the patient becomes more exhausted, delirious, muscular twitchings are there, dry and shiny tongue, hemorrhages and perforations are common in this particular phase. Abdomen becomes more distended, and gradually temperature begins to come down. It is called as fall by lysis gradually comes down towards the normal, and suddenly if the temperature drops down, that is a very critical stage. It is said as the temperature falls by crisis, means there is perforation or serious complication has taken place. That is the indication of drop of temperature by crisis. Another more important condition where the Ellen tells us about dysentery of old people. This is the old small term which he is using the small sentence. So let us go for what is the dysentery. The dysentery is a broad term which includes so many things. So important dysenteric conditions we'll see, but what are the symptoms? The clinical feature include abdominal cramps, tenesmus, and frequent passage of stool containing blood and mucus. It is very painful and incapacitating condition, especially in elderly, and there can be serious complications which can take place, and they include like dehydration, intestinal perforation, and septic state. The most common type of dysentery and their causative agent, they are: number one is amoebic dysentery. The onset is gradual with diarrhea and bloody stool. Fever is usually not present, and if at all it is present, you will find that it should be associated with tenderness in the right upper quadrant, which is because of the liver abscess. That is one of the very serious complications of amoebic dysentery we have. Another condition is bacillary dysentery. This is also known as shigellosis. It is caused by the 4 species of genus Shigella. Shigella dysentery is the most virulent and most likely to cause epidemic of dysentery. Shigella soni is the mildest species. The most common form is Shigella body and Shigella flexerni. Please remember, Shigella flexerni is the species. Thereafter, the patient goes to develop a reactive arthritis, which is previously known as Reiter's syndrome. It is a arthritis which is going to follow after especially Shigella flexerni, and it has got a classical presentation which is known as triad: conjunctivitis, urethritis, and arthritis. Arthritis, conjunctivitis, and urethritis. 3 symptoms point to reactive arthritis, and which was known as Reiter's syndrome. Another condition is diarrhea of children, especially when very offensive. So we'll clinically correlate. Diarrhea is a frequent loose watery bowel movements. Etiology is acute diarrhea, usually caused by antibiotic use, food allergies, food poisoning by virus. Chronic diarrhea usually caused by dietary factors and infections. Mechanism of diarrhea includes following: osmotic diarrhea, it results from presence of non-absorbable solutes in GIT tract, as with lactose intolerance. And if you suspect such condition, if you don't give anything by mouth for 2-3 days, especially the offending agents, you will find the osmotic diarrhea will subside on its own. Second is secretory diarrhea. It results from bacterial toxins that increase secretion of chloride ions and water into the intestinal lumen. Secretory diarrhea does not stop with fasting. Inflammatory. diarrhea. It is associated with Crohn's disease or ulcerative colitis. The resultant outpouring of plasma, serum protein, blood, and mucus increases fecal bulk and fluid content. Baptisia, how can be remembered? So we have a mnemonic, and that is Baptisia produce symptoms of diphtheria. Here the B stands for besotted looks, P stands for prostration, S stands for septic state, and O stands for offensiveness, D stands for dual state, delirium, drowsy, dysphagia of solids. Dual state is a sensation of scattered, as if body parts are scattered. Thank you very much for your patient listening.